Okay, good afternoon, everyone. Take a seat and we'll get started. Thank you all for being here today. In discussion with my new co-chair, Walker Thomas. Welcome.
Thank you.
And appreciate, and we also have some other new members. Senator Funky Fromeyer is with us now, and also Representative Camuel. Thank you. And Senator Elkins is also a new member. And after some discussion earlier, we'll start a new tradition next week. Next month, we'll open with prayer and pledge of allegiance. And with that said, Madam Clerk, would you please call the roll?
Senator Berg. Senator Elkins.
Present.
Senator Funky Fromeyer.
Present.
Senator McDaniel. Senator Neal. Senator Nemus.
Present.
Senator Wilson.
Here.
Representative Bojanowski. Representative Camuel.
Here.
Representative Duval.
Here.
Representative Fleming. Representative Johnson. Representative Petrie.
Here.
Representative Tipton.
Here.
Allison Ball, Auditor Ball, excuse me.
Here.
John Hicks. Victor Maddox. Sharon Mattingly. Representative Hale.
Present.
Senator Higdon.
Here.
Representative Thomas.
Present.
We do have a quorum and can proceed. Entertain a motion for approval of last month's minutes. We have a motion. Second. All in favor signify by saying aye. Aye. Opposed? Motion passes. All right, on with the business. We'll start off this day. We'll skip around a little bit. Senator Robbie Mills, if you want to bring your folks to the table, and looks like you got a large following today.
We'll let everybody get situated here.
These aren't made for belts.
Well, thank you, Mr. Chairman, chairmans, and new members, too. A lot of new members on this committee. It's my first meeting not on PPOB in a long time. So.
We'll have you back.
Mr. Chairman, I'm here today to discuss legislation I plan to file this session that will change CERS retiree health benefits for members of the system on or after July 1, 2003. I know the general concepts underlying this legislation were discussed last year. I've been working on this a little over a year, and these details may have been before this committee, so it may sound somewhat familiar. I've heard from both employees and employers over the last couple of years regarding the adequacy of retiree health subsidy that was established in 2003. To address these concerns, employee and employer groups have worked together with me and several others for more than a year to develop a plan that enhances this retiree health benefit for CERS career retirees. The goal is to be aligned. The goal is to better align their benefits with the cost of an under 65-year-old health plan. Ideally, these changes to CERS health insurance system will help with recruitment and retention and maintain the solid financial footing of the system. In doing that, we're balancing the interests of retirees while also ensuring liabilities are addressed and employer cost risk are limited by including provisions in the bill that create a shared cost structure between employer and employees to pay for this enhanced benefit. Additionally, the bill includes triggers that adjust the employee contribution rate based on the level of funding in each respective health trust over time. To briefly summarize this draft legislation is as follows. The health subsidy of CERS non-hazardous retirees that retire after 27 years of service would increase from currently what they're getting is $14.63 a month for each year of service. That will increase to $40 a month for each year of service. The health subsidy for CERS hazardous duty retirees that retire after 20 years of service for Tier 1 and 25 years of service for Tier 2 and 3 would increase from what they're currently getting, $21.94 a month for each year of service to $50 a month for each year of service. The goal of these changes is to allow the retiree to be able to pay the cost of a single premium, which we believe is consistent with the goal of the legislature back in 2003 when it created this fixed dollar health subsidy. Employees will help fund this benefit by varying increased employee contribution rates depending on the funded status of each health fund over a 5-year period. Employees will contribute an additional 1% of pay if the funded status is between 120% and 150%, 2% if it is between 90 and 120% funded, and 2.5 if the funding falls below 90%. Right now, non-hazardous is funded at 122.3%, and hazardous is funded at 100.5%. We have a bill draft and preliminary actuarial analysis that we'll talk about here in a little bit, and are considering some small little tweaks to address situations where the funding exceeds possibly 150%. So we can continue to hold to the principles of shared cost and limited risk exposure for these enhanced health benefits. So that is a short overview, and I'm going to just start down to my left and allow my friends that are at the table to identify themselves and kind of chime in on how such legislation would help them with their employees and any other comments that they would have.
Jerry Wagner, Sheriff Retired, Executive Director of the Sheriff's Association. Certainly this would be a tool in our belt that we could use immediately. It would help us to hire and retain, and also it would help us to be able to rehire retired employees. As it is now, with the way it is, the folks can't afford to come back to work for the amount that they're receiving on their insurance. So it would be a big benefit to counties and CERS employees.
Jeff Taylor. I am the Legislative Affairs Director for the Kentucky Professional Firefighters. First, I want to thank the chairs and the committee members for taking up this crucial bill. It's important to note that back in 2003, when the subsidy was created, you were receiving about $15 a year per year of service, or $300 after a 20-year career. That at that time would pay for a single plan of a cost of, I think, $286. The family plan then was $644. So the subsidy has not kept up with the concept of offsetting the cost of a single plan primarily. This bill is critically important, I think, to our employees, our members. I think it puts them in control of their health care benefit. If you are an individual that wants to retire after 20 years, you'll get $1,000 a month under this proposed legislation. But if you still have a spouse or even children at home, choosing to work another 5 years or beyond puts you in complete control of that total cost, which is about $2,100 for a family plan. It's important to note this legislation coincided with the legislation that was passed in 2022, which adds an additional $5 for every year of service that you stay after your retirement threshold. Truly is go hand in hand with respects to putting the employee in control of what their health care costs are going to be. So we appreciate Senator Mills for taking this up, Chair Higdon listening to our concerns in the committee as a whole. Thank you very much.
Good afternoon. My name is Jeremy Thompson. I represent the Kentucky Chiefs Association. Again, want to thank you for your time, Senator Mills, and those who've taken the time to listen to our concerns, Mr. Cheney with the League of Cities. And I think most importantly, from the perspective of the Chiefs, is from a recruitment and a retention tool, this is a great piece of legislation that we can offer new and current employees. For decades now, at least the last 15 years, we've noticed a shrinking recruitment effort. We've had less people interested in our profession, and collectively we've been searching for ways to incentivize bringing people back into the field of police and, as you've heard, fire. And I think at the end of the day, those that remember what we started off on Tier 1, we used to tell folks that this was something that the light at the end of the tunnel. Wait until you get to the end of your career. You will see the fruits of years of service, because of the health insurance was one of the big driving factors. I know it was for me in my time in law enforcement. And I think what this will enable us to do is provide more light at the end of the tunnel for those current employees to help retain them, and then for the new employees, for that small group still interested in going out and protecting the citizens of our Commonwealth, is to allow them the understanding on the front end that there is light at the end of that tunnel, where you may feel like you have an uncertainty as you get older with health insurance. This will help provide that certainty. So the partnership with the league to share the cost, to share that responsibility, I think is a great step in the right direction. We appreciate that. And again, we thank you for your time.
Thank you, Chief. I'm J.D. Cheney. I'm the CEO, Executive Director of the Kentucky League of Cities. I don't know that I can add a tremendous amount beyond what Senator Mills presented and what our first responders have just told you about the importance of the health benefit. You all understand the history of our organization, having been very guarded over the past decade and a half, I would say, in terms of changes and benefit changes that could adversely impact employer cost in terms of the contribution rate. This is a situation where we were able to come and sit down and figure out a shared avenue to split that or share that cost for an enhanced benefit. And in my time, which is now, I guess, a couple decades here, working on behalf of cities in Frankfort, we haven't had a situation where the employee groups have been willing to be so collaborative, not to knock any of y'all's predecessors, but to share some of the cost in footing that bill. We realize that there may be some risk on the employer side, but it's measured. One thing that this does not do is abandon that approach in 2003, which mitigated the risk of tying this health benefit to healthcare inflation, and by using it as a flat amount. A couple of other provisions in the bill. You may think, well, if it's going to change based on the funded ratio, the employee contribution would change, that it might be a little unstable for the employee. There's provisions in this bill that require that to be measured over a 5-year look-forward period with the projected funded ratios. It sets that and at least will keep it stable for a 5-year period for the employee over the analysis. In fact, with non-hazardous, it's not predicted to dip below 120% funded with this change. So you probably don't see any increase. Actually, there's a 5-year period. I believe it's predicted to dip below 5%. I'm sorry about that. But in terms of implicating employer costs, there's no costs there. This does not change the over 65 subsidy since the premium's around $145 a month. The bill is retroactive in that it would also apply to the handful of Tier 1B retirees that have retired already who are on the dollar contribution subsidy. And then, of course, Jeff, I think, pointed out that the 2002 changes that Representative Kevin Bratcher got enacted back in the 2022 session would remain in effect as well. So we're supportive of this approach. We think it's a great way to deal with the successful funding ratio of the health funds, and hope you all will consider supporting it.
Very good, Mr. Chairman. I think that gives you kind of an overview, and I think since we have a lot of new folks on the committee here, I think it's important. You see police and fire up here. This is all CERS, non-HAS and HAS. So this benefit will flow through a lot more areas than just police and fire in your communities, this enhanced benefit. With that, I think we've got 4 or 5 smart people up here, maybe 4, but we'll try to answer questions. So thank you.
Representative Camriel has a question.
Thank you, Mr. Chair. And thank you all for bringing this, sitting here as a 15-year member, current member of CERS. And I work with a whole lot of people who are in CERS. And I feel like this legislation will be incredibly helpful. If I've got other questions as I'm learning more about what is going to be proposed, can I reach out and just talk with you all?
Yeah, you can contact me and we'll get you answers.
Awesome.
Yep.
Thank you so much.
And that offer is for anybody else on the committee as well.
Well, keeping with the new members asking questions, Senator Funky Fromeyer.
Thank you for giving me the opportunity to ask a question on day one. With the health insurance benefits, I'm not real clear. Is this a high deductible health plan along with a health savings account that members have the opportunity to put money into?
This is a Kentucky employer health plan. So it's a level dollar contribution amount measured on the years of service towards the monthly benefit to apply to that health insurance benefit to pay it.
And one other point of clarification, not fully understanding, is there potential for a high deductible health plan or a health savings account?
I think that would be determined by the systems or the state in another piece of legislation. I don't know about it being embodied here.
Okay, thank you.
Yeah.
I'll follow up with you on that, Senator Mills.
Chairman Petrie has a question.
Thank you. It may be just a couple of 3 brief ones for context, if I may, Mr. Chair.
Yes, sir.
Senator Mills, just making sure I've got the right context. I'm not seeing a draft in my folder of a bill that has yet to come out fully. Is that correct? Okay.
Right, yes.
Perfectly fine. Number 2, actuarial assessment is forthcoming also.
We have some preliminary actuarial that we could share if you'd like Mr. Cheney to share that with you.
If you'll share that in through the chair of the committee, and they can get it out to everybody if it's ready. If it's not, and you've got an update coming, fine. I just want to make sure it's forthcoming.
Yep.
And so at this point, we really don't know what the fiscal impact is among the C groups.
We can speak to that. Yeah.
Okay.
I think the changes that we might make to this bill before it gets to bill draft are minute and won't affect this that much.
Okay.
I think the lingering question, we looked at the preliminary analysis, Chairman Petrie, was what happened if it got over 150% funded? Mm-hmm. What's the fair way to do that in terms of what the employee, with these increased employee or member contributions are doing? How can that play out if it goes above 150%? So we've been talking about some tweaks there for simplicity's sake, which is I think is why we kind of hit a pause on sharing it. But if you look at the way it's triggered, the unfunded liability that it adds to the system is around $121 million for non-hazardous over the amortization period, and about $101 million for hazardous. And of course, the bulk of that is being paid off by, in most cases, either the surplus because it's 120% funded, or those additional employee contributions that go forward. Any benefit you add, obviously, is going to add to the unfunded liability anytime you enhance any kind of benefit. And so that's the preliminary projections on that.
Okay. If you will, just share those things as soon as you have them available with the co-chairs and out through the committee so we can take a look. Would be appreciated. Thank you.
Thank you.
One of the questions that I had when a employee retires, then they will, whatever years of service and whatever their, what is it? Monthly payment, whether it's $40 per year served or 50. If they're employed, now how will that be done? Will they just get a flat amount every month, whether they're reemployed and have their insurance paid already? Will they still receive the supplement every month regardless?
Yeah, it will continue on, and I might let one of the other gentlemen here that know how that subsidy is received.
So yeah, that is paid monthly. You're talking specifically about a rehired retiree.
Right.
So if you have a rehired retiree under the 2008 legislation, the employer is required to reimburse the systems for the cost of the plan if it's a Tier 1A. I'm looking to make sure I'm correct about that. I may have misspoken on that, but that subsidy amount I don't think changes.
So I guess in other words, I'm saying if a employee retires and they go to work and they have their insurance paid at their new job, they will still receive the subsidy every month, even if their insurance is provided at their next job.
They do not.
Okay.
We'll get you a clear answer on that, but I believe that subsidy goes toward payment of their benefit. Is that correct? I believe that
Does. I think you can have one or two options, right? I believe I'm clear about this from the 2008. I think.
Yeah, I'm just trying to figure out the logistics.
The 2008 legislation. If you're a rehired retiree, the employer is required to either have the employee waive participation in their retirement benefit and provide health insurance at the employer level, or to reimburse the systems for the cost of the retirement plan. I think those are the two things that were put in 2008, if I recall.
Now, is that if you go back to work in the system or out into the private sector? Either way.
No, just into the retirement system.
Okay, how would it work in the private sector if you took a job in the private sector and your insurance was paid? What would the subsidy? How would that be handled at that point?
I do not believe there would be any change that the employee would still be entitled to the health subsidy amount, the benefit that they accrued, if they went into the private sector.
Okay.
Senator, follow up. The way I read that is if you go into the private sector, you can withdraw your money for the purposes of open market for a healthcare plan only.
And what's the logistics on that? How is that handled? I'm just trying to picture how this will work.
Yes, sir. I think they have to demonstrate the need for reimbursement on that, and it's a process that exists today that members can utilize that money outside of the system, but only for the purposes of a purchase of healthcare plan outside of the system.
So there's already a process in place.
Yes, sir. There is.
That's good. Thank you.
Yeah, we'll get that answered and back to the committee. So, for sure.
Okay. Well, seeing no further questions, thank you, gentlemen, for being here today. And
all right.
Thank you.
Thank you, committee.
Next up, Senator Robin Webb. Senator, the usual thing, identify yourself for the record, and the floor is yours.
Senator Robin Webb, District 18, here to discuss Senate Bill 58.
Please proceed.
Thank you, Mr. Chairman and members, especially new members. I filed this bill last year, but it was kind of late in coming and certainly didn't get a chance to come before y'all, so I really appreciate this opportunity. What Senate Bill 58 does, it establishes the ability for a state employee to designate as a beneficiary a special needs trust. And several state employees have brought this to my attention through the last few years. And I think with the work that we've attempted to do in the General Assembly in addressing special needs and those individuals, this would be a natural progression of taking care of those individuals and providing our state employees some peace of mind and some mechanism for their retirement benefits to benefit that in a trust situation. The bill is so long because it has to go through every retirement system. It's really not that that wordy or that hard to understand. And certainly, Congress has previously established the eligibility for benefits and trusts and how that comes together. And as far as income resources and that kind of thing, and that's why the trust is so necessary. And we reference the congressional code in the bill, and also allows, the supplemental or special needs trust that Congress has established contains specific language which protects eligibility for government benefits such as SSI and Medicaid. As you all know, there's a resource cap for what eligibility is. And there's a few things that are designated for the trust to be utilized for, and that's adaptive equipment and technology for those individuals, personal hygiene and grooming, medical and dental care excluded from government benefit, and specialized care if not covered by government benefit. And that's pretty much what it does. I'm waiting on an actuarial analysis. I see Mr. Chairman Petrie's not here, but I knew that would be a question. The preliminary indication of the system is that it could be revenue neutral. KPPA is here, and we're beginning to discuss the bill. They had one ask as far as the written check provision as far as getting the money to the trust, and ask that be electronic. So I don't think that'd be a deal breaker for me, but if there's any questions, I have staff here, and I also have the KPPA is present, and if I can't answer it, I'll get back to you with a memo in typical lawyer fashion.
Okay. Representative Tipton has a question.
Thank you, Mr. Chair. Thank you, Senator Webb, for bringing this forward. Are these revocable or irrevocable trusts, or are there any distinction in the bill?
Well, that the trust naturally would, there's notice requirements in the bill for in case that beneficiary passes or the passing. And then any overpayments or anything would certainly be set back. The criteria would be established, federal law, basically, in my opinion, would dictate that. So you could change a beneficiary, like we can now. There's no prohibition in doing that if situation would change. But once that is distributed, there's notice provisions that are required. And then any overpayment would go back to the system.
Senator Funky Fromeyer.
Such a fun first day for me. These are things I live with. So I am a financial advisor and recognize that there are people that really are challenged by managing their own resources. What I don't understand about this is this specifically referring to adding the beneficiary as a special needs trust if a person is unable to be a direct beneficiary of a person that is currently a state employee, and the state employee then named someone in the event of their death for the payment to continue on to?
If you name a special needs individual without a trust, it could, by having those resources that goes over the federal limit, it would prohibit that individual from receiving many benefits. So if you do your cost-benefit analysis, it probably wouldn't sometimes be worth someone taking that on. But once you establish the trust, then it becomes the beneficiary for that individual with a trustee and set forth, federal and we adopt the federal requirements for who is eligible and for what those purposes are.
So otherwise, it may impact these financial resources that's received by the person with the special needs. It may actually then repay the expenses that the state or the federal government is paying for that individual.
It could, I think, defray some of those governmental expenditures, but it wouldn't prohibit that individual from getting the assistance that they would be entitled to without that resource.
I'll have to better understand. I don't fully understand the need for this legislation. I thought that was already authorized. Is that only a state of Kentucky restriction, or is that some?
Well, Congress establishes that, but for state employees specifically, they don't have the mechanism for their retirement benefits to be directed to that special needs trust. If they would leave that, their resource, any resource to that individual, that they could go over the income threshold. Mm-hmm. So it would come into play with federal criteria.
Okay. Yeah. Thank you.
Yeah, we can talk about it more. Be glad to.
Yeah.
And when I get the analysis back, I'll get it to this committee.
Auditor Ball has a question.
Yes.
Senator Webb, there may be some benefit to looking at the addition of additional language to include stable accounts. I'm not sure. You'd have to look into it. But stable accounts are often available when they don't actually have a special needs trust set up. So it's more easy to do it. So it doesn't have as many options that a trust has on what you could do with those dollars. But if one of the concerns is these dollars would go to somebody who wouldn't be able to keep them because of the income threshold problems, a stable account would fix that problem too. It might be worth looking at.
Thank you.
Senator Webb, you have an actuarial analysis on this.
We're waiting for that. The preliminary indication I got from KPBA was revenue neutral.
Okay. We'll see no other questions. Okay. Yeah, Young Will Schroeder has a question.
Always glad to hear from
Thank you, Mr.
the
Chairman.
former
and
senator.
Senator, good to see you. Thank you for your work on this. I think my Senator Fromeyer, was asking this. I'm not sure I understood the answer. So would this allow, and I'll just try to maybe personalize it a little bit so we could understand. So if I had a son who had, special needs, is this to help that person, or would this to be, what if my friend has a son? Would I be allowed to?
No,
is this a direct beneficiary?
It would run direct for familial lineage.
Thank you. Appreciate it.
Okay. Seeing no further questions. Thank you, Robin.
Thank you
Senator
all.
Webb,
Thank
excuse
you.
me.
Thank you. Thank y'all.
All right. Looks like first day I get to take the chair from Senator Higdon for a sec anyway. He's going to come down and present. And you know the routine. Introduce yourself, even though we all know you. And proceed.
Good afternoon. I'm Senator Jimmy Higdon. Today I have a bill to talk about sick leave, and we've had discussions about sick leave in the past, and this bill takes a little different approach. As many as you know, school districts are required by state law to provide at least 10 days of sick leave to each teacher annually. While all school districts are required to provide 10 days, it's a floor, and some districts provide a higher amount. Those sick days at the option of the school district, which all have done, can be compensated to a retiring teacher at 30% of their value and then included in their final salary of the retirement benefit. TRS then bills the state for the retirement cost for the sick leave program. As we have examined this program in recent years, we found out three things. Cost of sick leave program to the state were more than double the amount historically reported. As you recall, we paid off a significant portion of the cost through a general fund appropriation in 2022. Other forms of sick leave are being included as by the district policies, including personal and emergency days, and it varies widely from district and co-op. A review of the sick leave policy by TRS found that most school districts provide 10 days of sick leave annually, but may provide higher numbers of days may provide higher numbers of days. At looking at how the school district's doing, currently Kentucky's 177 local school districts and co-ops have somewhat inconsistent policies. 13 districts allow 10 sick days and 1 personal day. 52 districts allow 10 sick days and 2 personal days. 97 districts allow 10 sick days and 3 personal days. 15 districts offer even more, with additional emergency days rolling over to sick leave, several allowing as many as 16 days total that can be used toward their final retirement calculation. This lack of uniformity creates some disparities. The bill ensures that every teacher in Kentucky will receive equal treatment, with 10 sick days and 2 personal days rolling over into their final retirement calculation. If a district allows more, the district will bear the associated financial responsibility. So if a district allows the 16 days, then the state will pay for 12, 10 sick days and 2 personal days. The district will be billed for the additional cost for the 4 days. We also understand that some education co-ops are processing payroll for third-party entities, raising some additional questions. Who are these third parties? What is their sick day policy? Are they employing educators? And are those educators participating in TRS? This legislation will introduce uniform reporting requirements and oversight for all participating agencies to ensure accountability. Administrators who were in the system prior to July 1st, 2008 can be paid up to 60 annual days that have the leave incorporated into their final average, as well as the state is being billed for that cost. The bill does not take away benefits accrued or will accrue in the future for teachers. What it does do is cap the future state retirement cost for the inclusion of leave accruals by requiring school districts to pay the accrual cost if they exceed the annual accrual amount that is standardized under this bill. The state would pay the TRS actuarial cost of leave accrued as of June the 30th, 2025, and in the case of sick leave, will still require the state to pay the cost of sick leave accruals in the future up to the 12 days per year. Retirement costs for annual leave accrued by administrators on or after July the 1st will be paid by the district, but leave accrued up until that date will still be paid by the state. An example, if the bill's passed, a current teacher that has 200 sick days as of July 1, 2025, and they accrue 10 sick days annually, as well as 2 emergency days and 3 personal days, both of which are rolled into sick leave at the end of the year. Let's say the individual used no sick leave that day, and under this scenario, the state, upon their retirement, would still pay for the 200 sick days accrued as of June the 30th, 2025, and 12 of the 15 days accrued in the following year, and the district would be proportionally billed for the 3 days above the cap. This bill sets up standard reporting procedures regarding leave, which TRS has recently implemented most of these. The bill also requires TRS to clearly report sick and annual leave costs in the annual valuation and who pays the cost. The bill would also include that on or before July the 1st, 2020, that each school district shall provide up to 30 paid maternity leave days for a teacher or employee who give for the birth of a child. That's pretty much sums it up. And basically what it does, it just sets a cap for what TRS will pay. It doesn't take away anything, but those school districts that are allowing more than the 12 days, they will have to pay for the extra days going forward. And that's basically what the bill does.
All right, we do have a couple of questions. Senator Wilson?
Thank you, Mr. Chairman. And Senator Higdon, I appreciate the bill. I supported it last year and look forward to supporting it again this year. My question is that when a teacher has, or an administrator, I guess, has sick leave that they roll over to the next year, if I'm year one as a teacher, my pay is significantly less than what it's going to be year 27 before I retire. But those sick leave days that I've rolled over from year one that I still have, I'm paid for at year 27 pay. Is that correct?
That is correct. You're paid at 30% of the face value of what your pay is on the day you retire.
Okay, so it's not calculated based on what they were worth the first year, second year, third year going forward, any of that?
That's correct.
Okay, thank you.
All right, Representative Camille.
Thank you, Mr. Chair. Appreciate the opportunity, and thank you, Senator, for bringing the bill. I've got a couple of quick questions. One, did you say in this bill it includes 30 days of maternity leave? Does that include for families who are adopting, bringing a new child into the home?
You know, this is a process. If the bill passes out of the Senate, you know, they're certainly welcome to add that when it goes to the House. That's part of the process. But in this bill, it says maternity leave for the birth of a child.
Okay, thank you for clarifying that. And just to make sure that I understood the calculations of how you were explaining the sick day accrual and payout would be the 30% payout upon retirement. Would you run over those numbers again when you said that if a teacher has, sorry, and for everybody, just transparency, I'm in CERS, my husband's in TRS. So,
Well,
would you run over those numbers one more time, the 200
basically,
days plus?
basically what it says, you know, whatever you have as of July 1 next year, you'll have nothing changes.
Mm-hmm.
But in the future, if the school district gives you more than 12 days, 10 sick days and 2 personal days, if they give you more than that and you accumulate that, TRS will only pay you for the 10 sick days and two personal days. And we're not taking that away from the teacher. They can still get it. But the school district, if they're going to give more, they have to pay for them. They can give all they want as long as they're paying for them. But we'll pay for 12, and that makes it standard across the state. A teacher in Casey County and a teacher in Jefferson County would get the you know, right now, the majority of the sick day pay that we pay is an unfunded liability because there's nowhere along the way that that's paid for. The teacher does pay a portion when they retire, the 9-point-something% that comes out of that final payment, but that doesn't pay the full bill. So the taxpayers of Kentucky are picking that up, and it's fair for every school district to have the same number. And again, we have some school districts can well afford to do additional days, and that's fine.
I think the uniformity is important, so thank you for that. I really appreciate it.
Thank you.
Senator Higdon, I might have missed it while I was conducting things up here. On the for paternity leave, is that just for the female giving birth, or is it for the male? I know that's been discussed.
Yeah, it's maternity leave for the parent, which would be the mother, that gives birth to a child.
Okay. All right. We have another question by Representative Tipton.
Thank you, Mr. Chair. I may have a follow-up to my first question. Senator Higdon, are you aware of currently anything in KRS statute that allows school districts to roll personal and emergency days into sick days to be used for final compensation for retirement?
I think it says they're not allowed to. If I'm correct, I'd have to call on staff to back me up on that. But I think it does not. There's nothing that says they're allowed to do that.
If I could follow up, Mr. Chair, so we have districts that or implementing policies not allowed under KRS statute. So as your bill is drafted, it would be a more liberal policy. They'd have 10 sick days and 2 personal days that could be used under KRS statutes. Am I correct?
That's correct. And I filed this bill last year, and what, conversation with the KEA and JCTA and other teachers, they did not want to lose those personal days. So I deal with the art of the possible. And I think this is very fair. This allows the 12 days that we all thought was out there to start with. But like I said, when you got a district that gives 16 days, that's a bit north of what we thought we were doing. And again, it creates an unfunded liability that the taxpayers of Kentucky had to pick up. I'm not trying to take anything away from the teachers. I want them to make sure that they get the benefits that they think they have coming, or they know they have coming. But we need to have it needs to be standard across the state.
Mr. Chair, if I had one more brief question.
Go ahead.
You mentioned the appropriation we made in 2022. I believe that was we were paying off the amortized cost of sick leave days to the
That's
tune
correct.
of about $350 million roughly.
And the green box dollars.
Those green box dollars. And now, but we still have we're adding an annual cost, additional unfunded liability. You know what the current roughly annual cost for the unfunded liability for sick days is in Kentucky that the taxpayers of Kentucky are paying?
I would have to grab a number out of the air. I think I know what it is, but
I think it's around 30 or 40.
Okay.
In that neighborhood, but we could get that verified. Thank you, Mr. Chair.
All right. Do we have any other questions or comments or anything? Senator Higdon, thank you again for bringing this. I look forward to hearing more on it, and especially once you file it.
Thank you, Mr. Chairman.
And I will go ahead and just wind out the meeting unless you'd like or have any more comments or anything. Tentatively right now, of course, we're in session, so that's subject to change, but tentatively our next meeting will be on February 24th. Yes, sir.
Members, you should have in your packet last month in December, I presented Bill Request 357 on teacher retirement reemployment. After that discussion and conversation, I went back and made some changes to that statute, additional changes. So you should have those in your packet. If anybody has any questions, you can get with me.
All righty, I'll go ahead and finish out. We're pretty well finished. I'll have a motion that we adjourn. And a second by Representative Johnson. If there's no other business, we'll see you in a month.